Good day and welcome to the next session of Planning for Sustainable Financing. We'll just give it a few more minutes for participants to join and then we'll get started. Thank you. Okay, why don't we get started? Welcome, good day. Welcome to the next session for Planning for Sustainable Financing. Today's session will focus on cross-cutting areas such as gender, equity, rights, civil society, and community engagement. My name is Melinda Frost, and I'm a unit head for the WHO Health Emergencies Program on Learning Solutions. I'll be joined today by a few different colleagues to talk about today's different aspects. The overall goal and purpose of this webinar series is to assist countries in developing successful national plans or proposals on sustainable financing for health emergencies, in particular for the Pandemic Fund's second call for proposals. Today, we're joined by two of my colleagues in WHO, Emily DeGrazia, who is Project Officer for Gender Rights and Equity, and Dr. Kai van Harbo, who's the Unit Head for Community Readiness and Resilience. We'll also hear from one of our partner organizations, UNICEF, James McQueen Patterson, who is the Senior Advisor for Health for HEPR at UNICEF headquarters. So with that, I think we'll go to our first presenter, but please know that this is being recorded. You will get links to the recording as well as the PowerPoint presentations following and any frequently asked questions. If you do have questions, please put them in the Q&A function of the Zoom chat. And if you don't mind, please take a moment to enter your name and where you're registering from, where you're from in the chat section. We'd love to hear who you are, where you're coming from, and what you're doing. So thank you so much for that. With that, Emily, please go ahead and start. Thank you.
Thank you, Melinda. So good morning, afternoon, and evening to everyone, wherever you are. So my name is Emily DeGrazia. Just as an overview, in January 2023, I joined in the WHO Department of Gender Rights and Equity at headquarters in Geneva as project officer. But before this, I worked in various international and regional organizations, including civil society, mostly in-country offices, mostly in the Balkans and notably in Tanzania. Essentially, throughout my career, I've been involved in drafting proposals, providing advice on them, and developing and overseeing specifically gender-responsive, human rights-based, and equity-oriented approach across various projects. So in this presentation, I will really focus on the concrete step that will allow you to incorporate gender equality, human rights, and health equity when drafting a proposal, and essentially planning how you would yield the desired result. Maybe we can go to the next slide, please. So maybe to start would be to know, why does it matter at the end of the day to embed those approaches at the very start in project design? First, there are legal, non-negotiable, and moral imperative behind this. Equality and non-discrimination are at the foundation of everything that we do in our common goal. As many of you may know, emergency affect individuals differently, and for various of reasons, it manifests in various ways. So regard what gender you are, where you're located, your socioeconomic background, ethnicity, sexual identity, age, and so on and so forth, sometimes clearly identifiable due to political and legal framework, or more discreetly through societal norms and structures. And that limits access not only to services, but it can also exacerbate distrust between groups and widen gaps. So planning for it is also a necessity within the project. And that is why not only why, but one of the reasons why international commitments such as the SDG reflect those moral imperative and the needs for success. It's becoming increasingly a frequent donor priority and a requirement in proposal, as is the case in the Global Pandemic Fund. So to recall, there's no size fits all, that can reach everyone. It's not just a nice add-on. Doing this allows you to bring everyone in. Next slide, please. So now that we are aware a little bit of the why, let's move to the how. Because in my next slide still. In my experience, it's not so much the question of why does it matter that comes over and over again, but rather the how do we actually embed gender-responsive, human right-based, and equity-oriented approach in our project? What does that mean concretely? In the next section, I want to provide you with an overview of the step that must be taken to properly reflect action in your proposal. Now, I want to stress that there are many ways, there are many methods, there are more prescriptive and adaptive way, but the step that we discuss here is some of the core and essential steps. And I want to stress once again that although I am now focusing specifically on how to embed them in a proposal, these should be continuously part of the project cycle overall. Thank you. Next slide, please. So step one, data collection and analysis. Just like any project, there must be a clear justification for its necessity. This might stem from identified gaps or issues within a particular population, country, or region, and those assessments are normally conducted during project proposal phase, and it can be more formal, informal, but the ultimate goal is to understand what we need to address. When it comes to leaving no one behind or embedding genders, it's really also about taking the time to collect evidence on inequalities in the population and context that you're looking at. Essentially, you want to make the invisible visible. You want to know who's left behind, how they might be, and why, especially as it relates to the specific priority area that you will be targeting in your project. Identifying those differences is also something that might allow you to understand how the project will affect them. Either it will not at all, either it will affect them positively or negatively, and you need to understand that and address that. Now, at this stage, there's no need to start from scratch, when there are plenty of existing resources that hold relevant information. National Statistical Office and Survey, website, database of international organization, national civil society report, and so on and so forth, offer a solid starting point for gaining insight and overview. And it goes without saying that consultation with key group representatives, such as even women representative, community representative from the outset is very much advised and can fill many gaps in data. Now, in an ideal world, at this stage, you would be able to complete a comprehensive data collection process from both existing data and having a community and stakeholder consultation. And not only that, to conduct and report on the result of a gender analysis, a barriers assessment, and a human rights assessment for your project area. But here's the thing. These analyses move beyond the facts to just understand the underlying reasons behind the issues. It provides more opportunities for action. But let's be honest, concretely, it might be that there's not enough time, resources, expertise, or fund to conduct such an overview at the proposal design stage. So please still go ahead with data collection and analysis as much as is humanly possible. And if you need to, add the conduct of a gender analysis, a barriers assessment, and human rights assessment as part of your project beginning activity, and use the time to readapt component of those activities once you have done those analyses. Next slides, please. Talking about activity. Based on the needs, challenges, and opportunity that you've identified, you need to review the activity that you plan and see whether there's any adjustment within these activities that you need to know and do in order to address and consider the needs of groups living in situation of vulnerability or may be marginalized. You can also and should conduct and design activity that specifically address these needs and opportunity, whether they were initially overlooked or briefly considered. I've put some example here that you can see and that you can adapt to your project cycle. But here's the thing, depending on how much you go into details with your activity at the proposal stage, do at least plan for this review and for this consideration throughout your project. Next slide. So here's the thing, and I think that this is the most sensitive and complex topic, and it's about resources, right? From my experience, the needs are always greater than the funds are available, regardless of how many funds that you will get. And there is a normal process of prioritization, and if not, a competition within, the project resources and how you will allocate that. However, here's the thing. You cannot consider gender, equity, human rights, and do activity without allocating resources for it. At a minimum within the project, and I tell you that you will save yourself a lot of headache if you hire or at least assign somebody, one project officer expert, to oversee this implementation in gender, human rights, and equity approaches in the planning, implementation, and monitoring throughout your project cycle. That ensures consistency and is a key measure that you can do to ensure that it's going on through the project. And don't forget that person should have enough knowledge to lead this process, but should also have the authority, because there are other types of costs linked with GRE activity, and especially human resources. You will still need staff time from other project officer and generalists. And if you press the button, you will see here is a measure. So it's very complex to assign exactly how many resources, but a good measure would be to allocate at least 15% of known resources toward gender equality, human rights, and equity within your project. This is a human base. Now, at the end of the day, do at least provide those resources. Give yourself enough time and money to be able to do that throughout your cycle. Otherwise, there is no way to see how you will actually conduct and embed those approaches. Next slide, please. I will not go so much into community engagement because my colleagues are much more expert here, but I just cannot do a presentation without actually stressing how important community engagement is, has an important component of a human rights-based approach. The right to the highest attainable standard of health described in various instruments is not just something you say, but there are actual general provision that stresses how to implement that. The principle of non-discrimination is one overall, but also the acceptability and people participation in decision-making processes. And that is key, the acceptability project. If you press on the PowerPoint, all I want to say is, and as my colleague will guide you through, just make sure that not only at the proposal stage you engage with community, but that within your plan, you plan for continuous community engagement throughout this. So next slide, please. Finally, one of the main great consideration is just how you will monitor and control the integration of GRE throughout your project. That includes providing an accounting for a specific series of qualitative and quantitative indicators. At the very minimum, you should include into your project that you will monitor the project activities, beneficiaries, and recipients as appropriate and offer disaggregated data such as gender, age, ethnicity, location, health status, socioeconomic status, etc., as relevant to your project and tailoring, and to systematically collect and report on that. This is how you ensure that you're inclusive as possible and you're able to address them during project going. Other indicators should also assess your project impact on gender equality and human rights and health equity and how your project has managed to really address these issues in society. Next slide, please. So I will soon finish this presentation and I'll happily answer questions at the end during the Q&A, but I wanted to leave you at least with as simple as possible this recap. You need to collect and analyze data as systematically as you possibly can. And if you cannot, for whatever reason, add it as a project activity that you will plan for and continuously do. Secondly, you need to use that information to redefine your project activity, design your project activity, and allocate the appropriate amount of resources that is well embedded within your proposal. And finally, incorporate in the M&E framework to make sure of that. And throughout this process and within, cannot stress enough, engage with the community. They know what they need, and they will be able to help you get your project success. So thank you, Melinda. Don't worry, I am soon done. If you press on the button here, leave no one behind, which is the UN say, is more than just a cap phrase. We need to see that reflected in your proposal concretely, just like other activity, and we need to do that. In the PowerPoint, which will be shared with you, you will receive more info. There is a recap in the next slide, please. You will see a more detailed recap. There are also resources and annexes that you can consult. And I leave it now to my wonderful colleagues. Thank you very much, everyone.
Great. Thanks, Emily. I think this was really, really nicely done. Very practical approach. particularly for those of us that have been really trying to get more gender equity and rights into our programs, but maybe not always knowing how to do that and how to do that in a very measurable way. So thank you very much. Your guidance was extremely clear, which blends us right into the next topic, where we're going to hear from Kai van Harbo about practical considerations for developing strategic objectives, goals, and activities for country proposals as related to civil society and community engagement. Kai?
Yeah, thank you very much, Mindy. Thank you, first of all, for the invitation and for the opportunity to present. My name is Dr. Kai van Harbo. I'm the Unit Head for Community Readiness and Resilience in the Country Readiness Strengthening Department here in WHO. And also thanks to Emily for this really great presentation, which I think complements very well with my very short presentation on some practical considerations for developing country proposals for the pandemic fund related to civil society and community engagement. Next slide, please. And before diving in a bit more deeply into the key activities that we recommend to conduct in the proposal development, and also highlighting a few activities that can be included in the proposals around the three focus areas, I just want to use a few minutes to put this into the context of our ongoing efforts by WHO with our key partners at the global level to advance this important topic of community protection within health emergency management. And as you may know, WHO has included community protection as one of the 5 subsystems of the new Health Emergency Prevention, Preparedness, Response, and Resilience, or HEPR framework, along with surveillance, clinical care, coordination, and access to countermeasures. And this is really based on a recognition of the lessons learned from the COVID pandemic and many other health emergencies about the critical role that communities play in any emergency, and in particular, the importance of joint decision-making with the communities. So to ensure that community members see interventions as relevant and acceptable, because only then we can really ensure the acceptance and uptake of public health advice and healthy protective behaviors. And of course, this can ultimately mean the difference between a localized contained outbreak and a rapidly expanding epidemic. Next slide. And I think this is important to highlight because, as you know, the second round of pandemic fund calls for applications around the 3 priority areas: early warning and disease surveillance, lab systems, and health workforce. But it also includes a specific call for applications that demonstrate community engagement, civil society involvement, gender, and broader equity considerations in the project design and implementation. And community protection really emphasizes this need for co-designed and co-developed approaches across emergency management with those that are at risk or affected, to ensure that decisions and actions are reflecting the needs and realities on the ground. And just as communities are seen as very important stakeholders and key partners, similarly are the organizations that work with them and represent them. And these are most often civil society and community-based organizations. Next slide. And these civil society organizations can really bring a very important perspective to decision-making when designing the proposal, and also, of course, in the implementation process. And the continuous engagement of representatives of the community ensures the trust among the population. And this is a key factor for the success of any kind of intervention. And this, as Emily has mentioned already, needs to be built in a sustainable way, in a continuous process, through enabling, informing, and empowering communities, and have communities and CSOs being part of the process throughout. And now I will speak a bit more on what this means for the proposal development process and how you can ensure a more inclusive and participatory approach with meaningful dialogue with community members and CSOs in the development and design of proposals and their implementation. Next slide. And just to say that this is also important because part of the evaluation of the proposals includes scoring criteria on coordination and co-creation of proposals. And strong proposals need to demonstrate concrete evidence of this process, of the collaboration, of the co-development. And I will speak a bit on how this can be done. But to achieve this, we really recommend these three key activities. First, we recommend to bring together a multi-stakeholder group, and that includes community and civil society representatives already in the proposal development. And ideally, this should be built on existing mechanisms that are already in place. But as Emily mentioned as well, I think we also acknowledge that time is short in this process, and we have to be time and cost effective in this process. So whatever mechanism you can establish to conduct a meeting, to engage with community and civil society representatives, this is already a great part of the process. And we really recommend to start with an abbreviated stakeholder mapping exercise to ensure that those from government, community, civil society, all the key stakeholders from different sectors are mapped and included. And in particular, of course, from our perspective, community and civil society stakeholders that represent the population have to be included and mapped. And then to invite their participation in this process as early as possible. And then to set up a meeting or any other mechanism to really gather feedback in a meaningful way from those stakeholders already in the proposal development. And then to make sure that this process is well documented, the process as well as the recommendations that were made. And then, of course, that they are implemented in the process and that you ensure that documentation is attached to the proposal. Second, we recommend to include participation and inclusion activities and mechanisms into the proposal so that they are a core part of the design of the proposal and that they are costed as well. I think that's also something that Emily has a bit alluded to. It's very important that there's dedicated capacity, a focal person, and that there is sufficient financial and HR allocation in the proposal to ensure this the implementation of this mechanism. And third, we recommend to integrate considerations around gender, vulnerable and marginalized population, and human rights into the proposal design and implementation plan. And Emily has spoken already quite a bit on this. Next slide. And finally, just to highlight a few very concrete activities that strengthen community-centered functions and capacities across the pandemic fund to priority areas. And we also included these activities and all the recommendations in this presentation also in the guidance note that was developed, and I believe that was shared with you already, where we also mapped these activities across the JEE indicators for the proposal development. And here in priority area 1, early warning and disease surveillance system, and I'm sure that James will talk a bit about that area as well. But there, of course, we recommend activities around establishing or strengthening national or subnational programs around community-based detection, notification, and response, and ensuring the linkage to the national disease surveillance mechanisms and response systems. And we can support this through, for example, national and subnational workshops, development of plans and SOPs, and training of trainer packages, etc., to also cascade this down to the local level, including simulation exercises and including components to strengthen risk communication and community engagement for new and emerging events. Next slide. And I think this is my last slide. And then, of course, we have priority area 3 around human resources, public health and community workforce capacity. And there We have a number of packages available to really build and strengthen capacities, in particular looking at community-based service delivery, but also risk communication, community engagement, and infodemic management under the overall umbrella of community protection. And these packages include tools, templates for partner mapping, including civil society, scenario-based gap analysis and action planning, and then capacity building for community first responders, and trainings, again, around risk communication, community engagement, and infodemic management. So all of these materials are available, and we are ready to support. And further information around this can also be found in the guidance note that was shared. So I think I see that Mindy has turned on her camera, so I think I leave it at that and hand it back to you, Mindy. Thank you very much.
Great. Thanks a lot, Kai. I think right now we'll go to just a couple questions before we hear from James. Thanks a lot, Kai. I think it's important, this isn't a question about sort of a definition, but rather when we say community engagement in the context of the pandemic fund, can you maybe just describe a bit more about what we're talking about for the pandemic fund writers, the proposal writers? Kai, I'll go to you.
Yeah, thank you very much. I think what is important is, again, to follow this participatory approach with community representatives in the proposal development as well as in the implementation, and that includes really to listen, to have community members, give them a seat at the table in the decision-making process and around the implementation, and that includes also feedback mechanisms throughout the process. So this is what we really recommend to ensure that proposals are not developed and implemented only at the national level without taking into consideration the needs and the concerns of the community. And because we also have to, I think it's really important to highlight the strong capacities that are usually already in place at the community level. And so approaches on building capacities should really build on existing capacities and mechanisms that are in place.
Yeah, that's such an important point. And I think many organizations that aren't used to working with communities will often be a bit surprised, happily surprised, at the strengths that communities bring to the table. So thank you for that. My next question has to deal more with, I think both you and Emily have presented some really nice structured approaches to including communities, ensuring gender equity, and so on in proposal writing. But how can we take those recommendations and draw them to other contexts, such as fragile, conflict, and vulnerable settings, low income, or transitional economies? Maybe, Emily, I'll go to you first, and then Kai with the same question as well. How do you take the recommendations you've provided and extract those to other settings?
Thank you so much for the question. Absolutely. So in any case, during your project design, and as you collect your data, as you engage with community, you need to take in consideration the context in which that might have happened. You need to not only take in consideration the context as it is, but also the historical reasons behind this. In fragile context, in post-conflicts area where I used to work, for example, that had also something within the relationship between these. It's very important that you tailor this to your actual context. And here's the thing, it might be a lot of time, as I mentioned, there might be a lot of resources available. But the truth is, sometimes you won't find it. And I think that this is where it merged very well with the presentation that Kai is doing. When in doubt about these contexts, about the particular, whether thematic area or context as well, talking to the community, getting their insight, understanding their lived experience will be the first way in, right? So I would say this, and again, it changes as context area, as you mentioned. You just need to be very much aware of that. The steps are the same, but then the information that you collect, the way that you actually incorporate it within your project activity will then change with that information.
Thanks a lot. I'll go to Kai. Same question. How do you take your recommendations and apply them to different settings, such as FCVs, low income, et cetera?
Yeah, thank you very much, Mindy. I think in particular FCV setting, but also many kind of lower resource settings are kind of characterized really through a strong presence of civil society organizations and community-based organizations, and sometimes even a stronger role, in service delivery, in community-based surveillance, for example. So it's even more relevant oftentimes in these settings. So that's, I think, a strong recommendation to even put more emphasis on the stakeholder mapping, on the inclusion of these key partners in the development and implementation of the proposal. There's also very often mechanisms in place around the community engagement system from other sectors, for example, when looking at AAP, accountability for affected populations mechanism in many protracted FCV settings. So it's important to use those existing platforms. And then the last point is that in these settings, typically community members are having an even bigger role around service delivery already. For example, community volunteers, the community workforce, community health workers, etc., are oftentimes quite strong and established, often through different partners in place, and are the key kind of reference point for the community around health service delivery. So it's really even more important to include those in the proposal development and implementation. And I think what we can recommend in general is that, considering in these settings in particular, where the community is facing a multitude of risks and vulnerabilities beyond the pandemic risk, is to consider how can activities cover multiple hazards? How can they be useful for to kind of strengthen the capacity of the community to withstand different types of emergencies? Of course, we focus on the pandemic hazard in this proposal, but many of the activities, the majority of activities that we are conducting to strengthen capacities are also beneficial for other hazards. Those would be a few points from my side.
Okay, great, thanks. Maybe one more quick question before we go to our next presenter. Must it be the situation where the community engagement, civil society approaches, and the key players proposed incorporate the One Health aspect in proposal writing? Yes, absolutely. And we have a lot of activities around that as well. We usually take it into consideration for any kind of communicable disease scenario, in particular, of course, when it comes to zoonotic spillover. And I think it's very often at the community level already much more the case than when you go higher up at the national, at the regional and global level, the integrated approach between sectors, in particular when it comes to the One Health approach. So it's really, really important. It's also included in the guidance note and highlighted. I didn't have time to go into it in the presentation, but it's very important, of course. Okay, great. No, that's a very good hint to provide. Thanks a lot, Kai. Okay, with that, we'll move on to our next presenter. Thanks a lot, Kai and Emily. Don't go anywhere, and we may be coming back to you. We'll be hearing from James McQuinn Patterson. I apologize, I think I mispronounced your middle name there, who's joining us from a partner organization, UNICEF, and we're going to hear a little bit more about country-level experiences now. Thanks a lot, James.
Thanks, Melinda, and good morning, good afternoon, and good evening. Very happy to join this and contribute to the discussion about how we can bring cross-sectoral priorities more prominently into our pandemic fund applications. I just have a couple of slides. I think a little bit will overlap or complement what we've already seen. I think it's very important to recall within the pandemic fund applications that these are built, of course, off national action plans for health security, the IHR benchmarks, the joint external evaluations and the findings to set out a set of priorities for the country. And hopefully, the country has already extensively engaged stakeholders If not, I think Kai and Emily have presented some opportunities to go and try and lightly bring that in a little bit more deeply. The pandemic fund itself, again, I think as you're all well aware, has opted to set out 3 priorities in terms of its applications. The first being around early warning and disease surveillance, the second on laboratory systems, and the third on strengthening human resources, the public health and community workforce. So to give a little bit of a flavor of what we are seeing in the first round of applications, I went through the project profiles that are available. For some of them, of course, we have the full description, but I don't have them for all 19 approved projects, so I opted to go for the profiles. I was interested to see to what extent community engagement and gender equality was present within these projects, or at least within the project profile as described. As I think Kai is just flagged, the 2 things that we see most consistently is community-based surveillance of one form or another, and risk communication and community engagement. And those appear predominantly within the early warning or the human resource strengthening. There was also in a large number of projects some references to specific vulnerable groups, such as in Burkina Faso, about the ongoing conflict and people that are exposed to that, and the specific role that humanitarian actors play within that. In Paraguay and the Amazon multi-country proposal, a lot of emphasis on indigenous groups and displaced communities, for example, were emphasized. They did not always appear in the activities, in what was planned to be done. So the context was well described, some of the specific challenges well understood, but when you started to look at the projects, it started to look very, very technical and not involving the community, or not trying to address gender inequality or other forms of inequities. And so I think that's something perhaps to look at when we dig deeper into our applications. So as we look across these project profiles, again, we emphasize where there are specific opportunities within the priorities that are chosen within the National Action Plan for Health Security to bring more community engagement. We look at specific actions that can be taken to address those inequities and those group vulnerabilities. And you'll see some examples there, and you'll have some very important examples within your own country. I was also interested, again, as Kai and Emily described, how the governance of the project, from design to approval and ultimately implementation, who's at the table when these projects are being designed. I think there is, of course, at the bare minimum, some sort of participatory stakeholder engagement, but certainly as we look across countries, we can see that the project design brings in complementary projects and all of the stakeholders that are involved there. It could bring in a women's group, for example, not necessarily to be a service delivery partner, but to bring the expertise into the project design, into how the priorities are being, priority activities are being defined and shaped. I think we can give great credit not only to community-based organizations and particular advocacy groups to understand what's needed, but to offer that as something to make a better project. And then it's up to the project then to determine if there would be a part that would pass for that group to implement a set of activities, or simply just to benefit from the rich analysis that goes in. So as you look at the project design, consider not only the consultation process, but also the governance process of how the project will be implemented. Could I get the next slide, please? So again, I was asked to look very, very practically at how this applies into the application process. As noted, full participation and representation of civil society potential delivery partners during both the assessment, design, implementation, and monitoring. I think this is a very easy opportunity. Again, if we look across some of the projects, we can see a variation of a group of 1 or 2 IEs together with a couple of departments within the government, and that is the group. And you look at other ones and you'll find a very full room with stakeholders that bring lots of different richness and expertise for a better, in my view, a better designed project, a more engaged process that pursues some of the priorities that are not supported by the pandemic fund in a more holistic manner. So specifically, that will lead to more shared priorities and better identification of delivery partners. And you will find that specifically in question 17 of the application, as you look at how does that look, how do you describe that? Second, there is the need to link and leverage co-financing. I think we've seen in the pandemic fund, the board and in its guidance documents, a very strong desire to see how the pandemic fund process is crowding in additional finance. Whether that is co-investment coming from the government, co-finance coming from implementing entities, or other forms of finance that are enriched, made stronger, more impactful by coming together in a wider set of actions, not all of which are financed by the pandemic fund. This has always been quite difficult, I think, for countries to bring together, but if you have that fuller participation and you can see these other stakeholders, these other contributions, it becomes a little bit easier. Ultimately, in the end of that, we want to see a leveraging and a crowding in of additional resources for the National Action Plan for Health Security. Questions 10 and 11, specifically in the application, push you to do that, but ultimately the real work is in pulling those partners together, understanding not only what their analytical understanding is and contributions can be, but what might be also some of the resources that they're bringing to the table. Finally, we want to anticipate cross-cutting themes within the application in the preparation of subsequent appraisals. So there's quite a bit here. Ultimately, you want to get yourself a high score, but hopefully it's not so cynically just to get the high score, but to really bring how community engagement gives you a better results framework, gives you better results, how civil society can give you co-creation and coordination of what's going on, how those actors contribute specifically and fundamentally how you reduce inequities, how you reduce vulnerabilities. And finally, there's a part on environmental and social safeguards. I'll just go to the last slide briefly. I wanted to make sure that a few resources were available to you. We discussed a lot about the process of engagement, but there's some resources, I think, to help you think through within your country and with those additional stakeholders that I'm sure you are engaging or will very soon be engaging as you design the pandemic fund. So on the far right, there is a set of guidance and recommendations on gender and public health emergencies, as well as a short course that you could take on gender-based violence and public health emergencies. You know, to give a concrete example, we all have seen vividly during COVID and many other outbreaks, women are the primary caregiver within the house. It's a little bit hard to imagine an effective community-based surveillance program that doesn't engage women who might be the first ones to identify and come into contact with some sort of an unusual illness. And yet, when you look at community-based surveillance programs, that doesn't always come out. Have a look at some of these guidelines for this short course, and maybe it will stimulate things that will contribute to what you want to consider within your own country. Second, in the middle there is the collective service that's been established between UNICEF, GORN, WHO, IFRC, and who's the other one? I can't remember. Apologies to that organization. They're doing a great job coming together and creating lots of packages and toolkits that can be used. So the one I put there is the Community Engagement in Humanitarian Action Toolkit. Very recently with the cholera group, they've put out a set of recommendations specifically for addressing cholera. Again, everything has to be applied and understood within your country, but I think these are useful tools and resources to help you understand how to find the right ways of community engagement within your country. Lastly, I share a couple of documents from UNICEF itself, and one is the operational framework, which, as you know, UNICEF gives a huge amount of emphasis to a whole of government, whole of society approach to pandemic preparedness. this is the way that we've shaped it out in terms of UNICEF's priorities, and it might contribute again to how you consider things within your own country, or for the UNICEF colleagues amongst us, guide where we would prioritize our engagements. There is also some additional recommendations for gender-based violence and public health emergencies. So I'll leave you with those tools. I hope these few ideas, specifically how we can apply it into the application process, is useful to all of you. Thanks so much.
Great. Thanks a lot, James. Very, very helpful. And thank you for sharing the tools. I'm sure they'll be very useful to the proposal writers. Just before you go, actually, I think we have a question. Was there, in your review of last year's proposals, or I guess pandemic round one, was there a common thread across successful proposals in terms of community engagement? And if so, what was that component of community engagement that made them so successful?
I would hesitate a little bit on that to say. So the common thread was that community-based surveillance in RCC was present in a very large proportion of the projects that were approved. There is a second tier that we know was considered acceptable, but there wasn't enough money. And so we're looking forward to them applying, taking some of the recommendations and being successful in this next round. So those are probably the two areas that I think we saw most consistently, most commonly. As I mentioned, at least in looking at the proposals, it was very hard to see how the governance process, right? So, what Kaya and Emily described about, participatory engagement, reaching out to stakeholders and so forth, that was not as well described in the project profiles. And so I can only share my personal experience, the anecdotes, that I can go into some sessions on the pandemic fund with country A, and I find the Minister of Health and the Minister of Agriculture in two IEs, right? And they talk. Now, I don't know if that's everything that happened in the country, but occasionally I see that's kind of what the narrative that they said. They came together and they wrote a project. And I go to another country and the room is super crowded, right? Zoom room. I'll find a USAID project implementer, I'll find some community-based organizations, lots and lots of people. They're not necessarily all speaking, but they were engaged. They were engaged long enough to come in and say, and the country wanted to put this forward, this is how they're approaching pandemic preparedness, this is how they're approaching the pandemic fund. And you'll see a narrative of how they worked through all of these stakeholders that bring resources, not just financial, but also intellectual, about what is needed to be done, what priorities are being set. Ideally, that is all set out very early on in the National Action Plan for Health Security and setting those priorities out. They've been engaged in the JE, etc. If that hasn't happened, you'll have to take shortcut steps, again, as was suggested, to do that. If I was to guess, I'd say it's like 50-50, some being really sort of a tiny little technical group that led everything, see more technical projects, and then you'll have groups that are more engaged. I think this round, you will see a preference and a greater weight being given to those projects that really engage communities and stakeholders in design and implementation of projects.
Okay, great. And I think there was a question asked a bit previously, and you did highlight on a couple of hints regarding how to highlight the participatory effect, and then feedback of that civil society. So essentially, you described two different scenarios, one which was kind of ministerial focused, and some that had a number of players that were at least engaged, if not, very actively engaged. Is there a hint to countries on how to get those voices, or those more seats at the table for those voices? And I think one of the things that I thought was really interesting that you touched on was just bringing together some civil society organizations that may have nothing to do with pandemic preparedness, but might bring a different aspect or link to other projects that need to happen in a country that may be lower resource. But any other ideas or hints to provide to countries?
Well, I think you described it well, and succinctly. You're not doing these things in a vacuum. We all know that, right? And sometimes it appears that it's a vacuum, that a small group of people do that. come forward. I think those projects will have to be extraordinarily strong to be successful, because the board has made clear that they're looking for that community engagement piece. They're looking for that gender equality piece, which is by and large absent across all of the projects that they've approved thus far. At least in the project profile descriptions. I can't say to every single activity in the project, but it doesn't elevate up. So the board is asking, the review committee will be looking. You're not in a vacuum, so some of these things are already happening. How do you bring that in? Clearly, as you finalize a project proposal, hard decisions have to get made about what's in and what's out, what partner is going to be receiving money. So possibly that contracts a little bit. But we will be looking, not me, but the pandemic fund will really be looking to see how that stakeholder engagement, that community participation was there. And I think we have to also really sincerely believe that doing that makes for a better project, makes for better implementation.
Okay, great. Thank you. And maybe I'll go to you, Kai, and then you, Emily. For countries that maybe lack that historical governance in this area of work, I mean, many countries, this may be new to really include the community as part of the decision making point. How can they kind of pull that together at this stage in a sustainable way? Kai, I'll go to you for civil society and community engagement, and then Emily for gender.
Yeah, thanks a lot. Yeah, I think as I think you said and others, ideally, of course, there is an existing platform, and that's really what we are advocating for, because again, this is not a one-off activity, and it should not be an activity also that is kind of initiated in the response to a new onset emergency. That it's very difficult to then have some really meaningful dialogue and establish a mechanism. This should really, and maybe this is an opportunity as well, that to trigger some kind of sustainable outreach and engagement with community representatives that can be triggered to this development of the fund. I think if that's and just to also say, I think there was a question on, is one CSO enough, etc. I think we are not the ones. First of all, we are not the ones that are scoring, and I'm not like in detail familiar exactly with how this is assessed, but the idea is, of course, to gather meaningful feedback and really from kind of representatives of the community. So and this should not be a kind of exercise, a token exercise to have where we try to have make it as simple as possible. I think the idea would be to really initiate a kind of more systematic and a broader process of the engagement throughout the entire project governance. And again, I think in the guidance note, we have some kind of steps on that, and it's not as kind of daunting maybe as it may seem right now, because I think all of us working in countries are familiar with the major civil society organization, with the major stakeholders that are in place. So if you make a bit of an effort to map those out systematically and then initiate the dialogue and engage with them, make a kickoff meeting, etc., I think this is all actually quite feasible to really gather feedback. And of course, there's also other kind of online options versus an in-person meeting that can be done to gather this input. So I think that's what I would recommend, really building on existing mechanism. In particular, when we go back to FCV settings, etc., there are a lot of typically ministry-led platforms and committees, etc., where the key partners are already engaged with.
Okay, great. And so if the governance structure doesn't exactly exist on that front now, it's a great time to start, and there's certainly something to build off of in every country. Emily, let me go to you with a similar question on gender equity. If this isn't already built into a structure of a country, what are some maybe quick methods to get started, but also in a very sustainable fashion?
Sure. So first, within the project, I will be very specific in terms of, the techniques and so on and so forth. So, you want to establish that framework. If, for example, you don't have the expertise or it's not there yet, first of all, I think it's worth actually, thinking about those resources and actually embedding that within your project, in how you will provide that. Because there are people, and just like Kai, just like everybody, who are very specialized in these things. So you don't have to start from scratch yourself. That expertise exists on the ground. Secondly, I think that one of the ways that you can do that within your project and within the government framework and kind of ask them to do that is really by providing very specific times in recurring meetings that you will do that. Ideally, we would talk to them every day. It might not be possible, but to have very specific monthly, bi-weekly, however it is, very concretely noticed. So just to really get that schedule in so that there is that reflection, and then it kind of goes beyond. And you can use different type of technique. As you say, if you want to, you want to provide advice, if you want to, do survey, get information, you do focus group, interview, brainstorming kind of technique, and you can involve that in those things. And, also take a time to engage with the government framework, to use different means of communication. ICT, we need to think about these things, but also to reflect on who has those capacity, who doesn't. Okay. So here's the thing I would say. First of all, if you don't have it, I think it's worth thinking about an expert and to, provide that expertise, right? If you do, you have it, plan the engagement and do tell government who you're advising that it's important to, as I said, do a stakeholder mapping, identify who, and also plan engagement throughout in a sustainable manner. So, town halls, all of these things as would do. And I think that would be, the most specifically as I can answer this question. So thank you.
Great. Thanks a lot, Emily. And then lastly, just one quick, I think, very important question. This is, I think, probably going to you, James. Could we shed some light on co-financing for these areas, given that many countries may have already developed an annual budget and didn't have a provision for co-financing things? Any recommendations on that front?
It's a tough one. I'm not so prepared for that. If I can, Melinda, I just wanted to add one additional point on the last part. There is a reality, not just a perception. These are highly complex technical projects. So as you bring in stakeholders, do not forget to explain what we're talking about, right? It's not obvious why early warning is important. It's not obvious why you need communities to come forward on this. So take time as you bring stakeholders in there to explain what you want. And again, I think, as Emily, I think in particular really emphasized, they'll surprise you. People will get it very quickly. It's not that technical. And they'll give you insights that you hadn't thought of to make it more successful. So in community engagement, the number one thing we want is trust, right? To get people to trust when some guys in white suits show up in your community to start collecting samples from bizarre parts of your body, right? That you need to explain why those samples are being collected, why those guys are or women are in white suits. And once the community understands that, they'll trust you. Heck, they'll go find the person that you missed. So remember that, take that time to explain what we're trying to accomplish. It's a lot of it is just bringing community engagement and gender strongly together, but it is important to do that. The co-finance part, sorry.
Oh, I was just going to say that my colleagues reminded me that we have another webinar on Tuesday that may answer the co-financing question if you want to be let off the hook.
Yeah, I probably would. I mean,
that's fine.
What I would say is that it tends to be a story. So it's newish money, likelihood of future money, that at least in the ones that I've seen, that's the way it is. In an ideal world, you're putting together the pandemic fund proposal, and some other proposal is being done at the same time. I think we saw that in a few cases where the World Bank was an implementing entity. They crowded that in to describe both processes being approved. that wasn't the most common. I think more common was they described an ongoing government co-investment. Personnel is always there. Massive amounts of government personnel are behind the back of these projects, and then co-finance in terms of projects that have recently been designed anticipating this type of additional support, things like that. But I'm sure your next session will do a better job on that.
Okay, great. Thanks a lot, James. Thanks for giving it a shot there. So let me remind everybody, we're about maybe halfway through this webinar series to help you develop your pandemic plans. We have another session tomorrow where we'll be hearing from implementing entities, WHO, World Bank, IFC, FAO, CEPI, and UNICEF again. And then next week, we'll hear more about resource mapping and mobilization, as well as monitoring and review. And the following week, finalizing the pandemic fund proposal. All of those sessions listed in white here on the navy blue slide will be held from 12 to 1 o'clock Central European time. The recordings will be available for later viewing, so no problem there. We'll be providing all of the slides and the Q&A, etc., and all of the tools mentioned as well. I do want to highlight one special session that will be held on Tuesday, April 16th from 10 to 11 a.m. That's Eastern Time, US time. And you can see the registration information there. I think maybe my colleagues will be sharing the link as well. And that will be coming from the Pandemic Fund Secretariat on implementing, monitoring, and evaluation. So great. If you have any questions, please email us at whespp@who.int. Again, that's whespp@who.int. Please take the moment to send us some feedback, take a picture of that QR code. Let us know if you have more questions, concerns. We will be sharing, again, all of the links for the webinar recordings, the PowerPoint presentations, the list of Q&As. I hope everything that you need. Okay, thank you so much for your time today. Thank you very much, Emily, Kai, and James, for sharing your wisdom with us. Very, very helpful for a very important portion of the Pandemic Fund proposals. Thanks again. Have a good day.